On March 9, 2020, Piedmont treated its first COVID-19 patient. While we did not know what the future would bring, we knew we would continue to pursue our purpose and make a positive difference in every life we touch. During the 16 critical months, we had diagnosed more than 39,000 cases. We cared for nearly 17,000 patients inside our 11 hospitals. And while we celebrate all of our COVID survivors, our thoughts go out to the loved ones of the people who lost the battle with this devastating disease. Piedmont would experience 3 surges in COVID cases, each one doubling in severity. And at the same time, we were navigating previously unimaginable challenges, like many concerned and often fearful patients, visitor restrictions, shortages of personal protective equipment, unmet daycare needs for essential workers, frequently changing guidelines, creating testing and vaccine centers, setting up locations for cutting-edge treatments, all while coping with the mental toll of caring for the very sickest in our communities. These are some of our facts, but here is our story.
I never thought we would be here. I kind of thought in 2020 this doesn't happen.
The doctor called and said, we don't think she's gonna make it.
The way this virus wins is by killing people.
The hospital informed us about the cases that were out west and that they were heading this way, and for us to start preparing for it, because sooner or later it's gonna come to Georgia and we're gonna get some cases.
Driving home and there's no one on the road and there's no one in the stores and everything is shut down.
It was like we were in some type of science fiction movie.
The stuff on TV in New York City was scary beyond description. I mean, they were getting refrigerated trailers to set up as morgues. And we began to gear up for being totally crushed by COVID.
Fayette was the place that started having the first wave of patients. And I remember there was a teacher in the community that turned out positive. And there was some period of time where they were in the hospital moving through the system before we got the positive test. And the guidance that we got from the state is all those employees need to go home and isolate.
It was a different world when the only people that we saw coming into the hospital were through the emergency room.
I don't know how else to put the sense of like walking in and seeing a whole unit, like a whole surgery department just closed.
It was only a week after our first admission for a COVID positive patient that 7 days later we had to shut down all of our elective procedures, operating rooms, our cath labs, our electrophysiology labs, all of our imaging, and on the outpatient world, all of our outpatient visits. So it was in a completely different universe that any of us had dealt with before.
Our church had moved from meeting in person to virtual. However, at the time, my father was the chair of deacons, and I was assisting my father by streaming the services. And out of that meeting, my parents, myself, and another 2 members contracted COVID.
It didn't matter necessarily if you had an underlying disease already or not. It truly was just how your body and your immune system responded to it.
The way this virus wins is by killing people, right? And the way it kills people is a certain number of people get exposed, a smaller proportion of that becomes symptomatic, and an even smaller proportion of those people get really sick in the ICU, and then some of those die. What we're trying to do is to minimize the overall impact of mortality on this virus, and that happens in how we manage the ICU.
I think in the beginning it was more how do we keep our staff calm, how do we protect our staff, how do we manage these patients, but now we're seeing it be more how do we deal with more of the critical patients that are being admitted to our facilities.
My mother could text, she could FaceTime, so she was staying in contact.
Not only did she have pneumonia, but she had some other things going on in her lungs that we didn't know about that COVID had kind of attacked.
So we went from thinking she's gonna be coming home to she's been transported to Piedmont Midtown, she's being moved to ICU, her oxygen levels have dropped drastically.
Sometimes families would ask, is my loved one gonna survive? And I mean, I had nothing for them because I couldn't say, well, yeah, they're young, they don't have this, so they got a good chance, because COVID affected everybody differently.
When someone is in the hospital, one of the bright spots that they have to look forward to is their family coming.
On August 15th at 7 a.m., the doctor called and said, hey, she did not do well throughout the night, and we don't think she's gonna make it. And I was like, she just texted me last night. Like, what are you talking about? We're thinking, we'll come up there, she'll smile, squeeze our hand, nothing's gonna be wrong. And by the time we got there, we were like 5-10 minutes too late. She was gone.
These are patients that if COVID had never hit, they would still be alive.
Because of the increased people who didn't make it, we had to add a morgue in the back of the hospital.
And I even had one that was gonna pass away and the family couldn't come in. I literally FaceTimed them for like 15 minutes and they sung church songs until she took her last breath.
We had a couple. The husband was going to be transferring out of the ICU. It happened to be their anniversary day, and so he brought her flowers and a card.
You've been waiting a long time. I know. It's been a while. It has been a while.
Nobody really expected her to kind of take a turn for the worse, but when she did, there wasn't a dry eye.
We had just finished one of our 3 o'clock calls, and I remember Steve Porter, the CEO at Fayette. Now, you could just hear the fatigue in his voice, said, we just intubated 6 more patients. When you're trying to manage all this information coming at you, CDC changes guidelines, staffing is short over here, I need ventilators, we're kind of okay on blood. You take all that data and you have to figure out where do we collectively as an organization need to focus our attention.
We had changed our protocols. Within those first 2 weeks, we probably changed them 10 times. People were just trying to do their job and make sure they were adhering to the rules and regulations that were being mandated.
I never thought we would be here. I kind of thought in 2020 this doesn't happen. You don't run out of resources. You don't, struggle with being able to care for the patients and your employees. That's not an issue.
Initially, when we had a COVID unit, we just had them contained to one floor. People were afraid to go to that one floor.
And the frustration with society not wearing masks, not following public health mandates. Meanwhile, here we are at ground zero, managing, the infantry that's coming in every day.
Standing outside the door trying to gown up, put your mask on, put your shield on. You're trying to protect yourself, but you see your patient in front of you basically dying because they need you to get in there and save their life. It plays with the psyche in your head because it's like, I have to protect myself to save you, but I need to save you.
Coming back home one morning, my father's laying in the bedroom on the floor. He had fallen and he couldn't get up.
We got him, back to the hospital, but COVID had really taken a toll on the health issues that he already had going into it.
And I would go every other night and just sit with him and talk with him and pray. And August 15th, my mother passed. My father passed on September 15th. Now I have to do everything I just watched my father do.
There were days that Some of the staff would just come in my office and shut the door and come over and just lay on me and cry.
It's hard to describe just how stressful the job of being a caregiver has been through the pandemic. Taking care of patients without their families in the room, the fear of your own personal health, all is something that not many of our caregivers have had to face before the COVID-19 pandemic.
We were really looking forward to at least taking a break before the next wave hit. And unfortunately, that never occurred. They knew it was scary, and you could see the fear in their eyes, but you also saw the determination to take care of patients, because this is why they went into healthcare.
A lot of families were experiencing what the McBride family was experiencing, and that just wanted to make sure that I was giving families like the McBride family and all the families that come in just the best care and comfort.
The staff that we had in all instances at Piedmont were extremely compassionate and kind and empathetic. These were nurses and techs and doctors that you could tell there was a genuine care and concern.
This one really kind of broke me down. And I'm one of those nurses that I don't really cry a whole lot. I don't, because you can't get so attached to your patients, but this was rough.
And that's the hard part. To work with a patient who doesn't make it is really hard.
You hear about soldiers fighting the war and, being with their buddy, and some of them not making it back home. It's crazy. It's crazy to see some people not make it back home.